All right, everyone, thank you so much for joining our webinar. We're going to be talking about the 2023 ICD-10-CM updates. It's one of my favorite topics to present every year. Basically, we're going to talk about the updates, what you need to have on your radar in terms of codes, code changes, guidelines, documentation, updates. We'll talk about the people, the processes that are going to be affected by these changes, and so on. So my name is Toni Elhoms. I'm your presenter for today's webinar. So we'll talk about the major updates. We'll talk about some of the code additions, deletions, and revisions. We'll talk about the guideline updates, changes, and then we'll get into some of the roles and workflows that may be impacted by the 2023 ICD-10-CM updates. So first and foremost, you want to make sure that you've got the latest and greatest ICD-10-CM guidelines. So we've got 1,176 new codes. We've got 251 deleted codes, 36 codes that were converted to parent codes, and then we have significant guideline updates. So the transition from the fee-for-service payment methodology to value-based care is continuing to drive many of our coding changes. So as far as our chapters, we still have our same chapters, chapter A through Z, and then we had a brand new chapter added, I believe in 2021, chapter U, which is our codes for special purposes. So in terms of our guideline updates, we saw a lot of changes to guidelines, updated language in documentation of complications of care. We also have updated language to the guideline documentation of complications of care. We also have updated guidelines for selection and sequencing of HIV codes. We also have an update and change to admission and or encounter for treatment of primary site for malignancy. We also have a brand new guideline for secondary malignant neoplasm of lymphoid tissue. We also have a brand new code for long-term use of injectable non-insulin anti-diabetic drugs. For dementia, so dementia completely exploded in 2023. We have tons and tons of new codes to reflect etiology and severity. We also have a new code for completed weeks of gestation. We also have a new guideline for hemorrhage following elective abortion. Do not assign code 072.1 for other immediate postpartum hemorrhage, as this code would not be assigned for post-abortion conditions. We also have an updated code for encounter for pediatric to adult transition counseling. We also have an update as far as language to the social determinants of health guidelines. So the major changes, not all inclusive, but the major changes are going to pertain to candidiasis, hemolytic uremic syndrome, thrombocytopenia. We have a lot of new codes for short stature, acidosis, lots and lots and lots of new codes for dementia, aneurysm, site specificity. We also have new codes for intervertebral annulus fibrosis defect, muscle wasting, epiphysis, lots of codes for pregnancy and maternal care. So now we'll kind of dive into some of the specific code changes. So with von Willebrand's disease, we've got unspecified, we've got type 1, type 2A, type 2B, type 2M, type 2N, we've got type 2 unspecified, type 3 acquired or other von Willebrand disease. For thrombocytopenia, we're seeing etiology built into the code. So we've got non-immune heparin-induced thrombocytopenia, immune-mediated heparin-induced thrombocytopenia, other, and then unspecified. And then we have a lot of new codes for short stature. So with dementia, We have so much going on with dementia. We've got 87 new codes just for dementia. Dementia and other diseases classified elsewhere, so it's associated with something like, let's say, Alzheimer's. Then we have some changes to muscular dystrophy. We also have separate codes for refractory angina pectoris. We have additional site specificity for aneurysms. We have new codes for intervertebral annulus fibrosis defect. We also have a lot of new codes for epiphysis. We also have pretty significant expansion to endometriosis. So we've got 168 new endometriosis codes. We also have a lot of new codes for maternal care. So we've got 200 new codes that have been added mostly to reflect the specific fetal conditions that were not accurately represented in previous versions of ICD-10-CM. You'll also see codes for maternal care for suspected chromosomal abnormalities, so Turner syndrome, sex chromosome abnormalities, other chromosomal abnormalities. We also have additional specificity for sleep apnea of newborns. We also have new codes for some of the defects, birth defects. So we also have additional codes for social determinants of health. And then we talked about our Z79.85, which is our new code for injectable non-insulin anti-diabetic drugs. We also have some new codes for personal history of, and then we have patients noncompliance for other medical treatment and regimen due to, again, financial hardship, other reason, or unspecified reason. We also have new codes, brand new codes for caregiver noncompliance. So those kind of spotlight the major changes. That's obviously not an all-inclusive list. You do want to make sure you pull the new code set so you can get the latest and greatest information. So who is impacted by these code changes? So similarly to the folks that are impacted, the workflows that are impacted. So some best practice tips as we wrap up, some resources that were used. You definitely want to check out the CDC, ICD-10 files, and then CMS ICD-10 files as well. So I want to thank you so much for your time and attention today. Really appreciate it. I hope that you have enjoyed the material. Thank you so much and have a great rest of your day.